Welcome back to the deep dive. Now, if you're gearing up for something like the MSRA, you'll know the professional dilemmas part, the SJT bit, isn't really about recalling clinical facts. It's testing your judgment, isn't it, under pressure?
That's spot on.
Yeah.
It's about those tough calls.
So today we're tackling those huge professional guidelines, like the GMC's Good Medical Practice, and we're trying to boil it all down into something really practical, a high-yield guide, essentially.
Exactly. The aim here is to give you, the listener, a real shortcut. Think of it as a kind of professor-level playbook, but one that's firmly anchored in those GMC standards.
Okay.
We want you to move past just guessing at options and really build that instinct, that professional autopilot.
So you react in the right way almost automatically.
Precisely. So you start thinking like a safe, professional UK doctor with, frankly, excellent judgment. That's the goal.
And I think we really need to hammer this home right at the start. So this isn't a knowledge test in the usual sense.
No, not at all.
It's testing your default reaction. How you respond when things get complicated, when there's conflict, or when a patient might be at risk.
It's about professionalism, safety, teamwork, ethics, all benchmarked at the level expected for, say, a foundation doctor or a GP trainee starting out.
It's fundamental stuff.
Absolutely fundamental. You can have all the clinical knowledge in the world, but if you fall down on the professional side, well, that's a major problem.
Okay, right. Let's dig into the core ideas then. Our sources seem to distill the whole GMC framework down to about 5 key principles. These seem to pop up again and again in high-scoring answers. What's number 1?
Number 1, and it's completely non-negotiable, is patient safety first.
Right.
Always. If you read a scenario and there's any hint of urgent risk, that absolutely has to be dealt with immediately.
So what does that look like in practice?
Well, high-scoring actions are things like escalating immediately if there's a hazard, calling a senior doctor, making sure incidents or near misses are properly documented and reported through the right channels.
Safety first, before worrying about feelings or reputation or anything else.
Exactly that. Safety trumps everything. Which leads nicely into the second principle, which is really another layer of safety: work within competence.
Ah, yes. Knowing your limits.
Crucial. It means you absolutely do not attempt a task or a procedure if you're inexperienced or unsure, certainly not without supervision.
Okay.
You have to be ready to promptly refer the patient or consult a colleague or get help from a senior. The key is never, ever compromising patient safety just because you want to look capable or avoid bothering someone.
Okay, but let me just push back slightly there. For trainees, maybe it's 3 a.m., the ward is chaotic. Isn't there a risk of being seen as, well, a bit needy if you call your senior for every little thing? How do you strike that balance?
That's a really fair question, and it is a real-world pressure.
Yeah.
But the GMC standard, the professional standard, is crystal clear. Your worry about seeming burdensome or, creating friction, it just doesn't outweigh the potential risk to the patient. Or your own accountability, actually. If you're at the edge of your competence and things could go wrong, you have a professional duty to escalate. In the exam, the high marks will always go to the safe escalation, even if it feels a bit awkward.
Okay, that definitely reframes it. It's about the standard, not the convenience. Got it. What's principle number 3?
That's all about communication and professionalism. This covers quite a lot, actually. Being honest, respecting patient confidentiality, which is huge, getting consent properly, and really importantly, it's about how you handle disagreements or conflict. The standard is privately, respectfully, and supportively. You just don't have those difficult conversations in public areas, or worse, in front of patients.
Keep it professional, keep it private.
Absolutely.
And what about the team, the system we work in?
That brings us to number 4, teamworking and duty of candor. Good teamworking is essential things like clear, thorough handovers, supporting your colleagues when they're struggling. But, and this is a big but, that support never comes at the cost of patient safety. Never. And the duty of candor is very specific in the UK. It's a legal and ethical requirement. If harm occurs, you must apologize to the patient, explain what went wrong, outline what will be done to put it right, and inform a senior colleague or manager straight away.
It's not optional.
Not optional at all. It's an institutional requirement.
Right. And the final principle, setting those clear lines.
Yes, number 5, fairness, boundaries, and integrity. This is where you look for those immediate red flags. Things like accepting inappropriate gifts, showing favoritism, treating your own family or friends, big no-no.
Okay.
Also, altering medical records, backdating entries, or trying to hide errors, and absolutely no cutting corners on care or documentation to save time. Plus, you need to be upfront about any potential conflicts of interest and manage them properly.
That's a lot to juggle in your head when you've got, what, 90 seconds per question?
It is, which is why having a mental shortcut is so useful.
Okay. So the sources flagged up a mnemonic for this, SafeC.
That's the one. Safe EC. It works as a quick filter when you're looking at the options.
Okay, break it down for us.
Right. S is for safety. Is there an immediate risk here? A is for authority, or escalate. Does this need senior input, or does policy need following? F is for fairness and integrity. Are professional boundaries, okay? Are the rules being followed? E is for effective communication. Is it respectful, confidential, clear? And C covers competence, capacity, and consent. Am I, or is the relevant person, qualified and able to act? Does the patient have capacity? Is consent handled properly?
Safety, authority, fairness, effective communication, competence, capacity, consent. Okay, I can see how that helps rapidly screen the options.
It just helps you orientate yourself quickly to the core issues in the scenario.
Brilliant. Okay, so we have the principles, but knowing what's right isn't quite enough, is it? You need to know how the exam actually works, how it scores you, because getting it slightly wrong can still cost you marks.
Absolutely. The scoring logic is crucial. You need to play the game according to its rules.
Let's unpack that. There are two main question types, right?
That's right. Two distinct types. First, you've got the ranking questions. You're given, say, 5 different actions, and you have to rank them from the most appropriate, rank 1, down to the least appropriate, rank 5.
No ties allowed.
No ties allowed. And the really important thing here is that it uses what's called near-miss scoring.
Near-miss scoring, what does that mean?
It means consistency really matters, perhaps even more than getting the exact order perfect. If you correctly identify, say, the best 2 actions and the absolute worst one, even if your middle rankings are slightly off the key, you'll still score pretty well. You get points for how close your ranking is to the ideal ranking. So every step closer gets you more marks, up to a maximum, usually around 20 marks for that scenario.
So locking down the best and worst options, the anchors, is really key for the ranking questions.
Absolutely paramount. Get those right, and you're securing a good chunk of the marks.
Okay, what's the second format?
The second type is the best 3 questions, sometimes called multiple best answer, but you choose 3. You're given a list of maybe 8 options.
Right.
And your task is to pick the 3 actions that, when taken together, form the single safest, most professional, and most complete response to the situation.
Okay, just 3. And there's a nasty sting in the tail with this one, isn't there? Something about scoring 0.
Yes, there is. And candidates fall into this trap all the time. If you select more than 3 options, say you pick 4, or even 5, because they all sound kind of reasonable, you get 0, a flat 0 for that entire question item. Doesn't matter if 2 or even 3 of your choices were actually correct.
Wow. Okay, so why is it so strict?
Because they're testing your ability to prioritize and synthesize. Can you identify the core elements of the best response? Picking too many suggests you can't distinguish the absolutely critical steps from the nice-to-haves or less relevant actions. It shows a lack of focus.
Right. Precision is key for the best 3. Okay, let's apply this. Going back to the ranking questions, how do we use that anchoring extreme strategy effectively?
Okay, so you read the scenario, you read the 5 options. Your first job is to find the 2 poles, the best and the worst.
Anchor number 1, the best action. What does that usually look like?
It's almost always an action that deals with any immediate safety concern and involves appropriate escalation or seeking authority. It ensures you're acting within your competence. If you think back to SafeC, it usually hits the S for safety and the A for authority escalate.
Makes sense. Immediate safety plus call for help or follow policy.
Pretty much. Now for the other end, anchor number 5, the worst action. How do you spot that one quickly? Again, use safeties as a filter. Look for breaches. Is there a clear violation of F, fairness or integrity, like lying or discrimination? Is there a breach of C, acting outside competence without supervision? Or, critically, does an action actively delay dealing with an urgent S, safety issue?
So, unsafe, dishonest, incompetent, or delaying critical action.
Exactly. The worst action usually falls squarely into one of those categories. It might also involve inappropriately deflecting responsibility, like telling someone else to deal with your problem when it's clearly yours. Once you've anchored the best and the worst, ordering the ones in the middle becomes much easier. You're just looking at the progression towards safety, good communication, and following the rules.
Excellent. That's a very practical approach. Now let's talk more about those absolute no-nos, the things that will sink your score,
Yeah.
the red flags.
Yes, avoiding these is probably just as important as picking the right answers. Getting high scores often comes down to reliably spotting and avoiding the predictable mistakes. The examiners put these in deliberately.
Okay, so what are the absolute definitive red flags we need to have on our radar? You mentioned four main ones.
Yes, four big ones to steer clear of.
Right.
First, treating or prescribing for friends or family, or for yourself for that matter.
Right, the conflict of interest is just too great.
Exactly. It fundamentally compromises your objectivity and breaches professional boundaries. It's a GMC fitness to practice issue, potentially.
Okay, number two.
Second, public confrontation or airing professional grievances in public spaces. Shouting at a colleague in the corridor, arguing over a patient in the waiting room, absolutely unprofessional. It breaches confidentiality potentially, and it fails the E for effective and respectful communication in safe C.
Got it. Keep it private, keep it professional. Number three.
Third, delaying action on any immediate patient safety or safeguarding concern. If there's a risk to a child, a vulnerable adult, or an immediate clinical danger, it needs flagging up now. Not next week, not at the team meeting, now. Escalation should be instant.
No procrastination when safety's on the line.
Precisely. And the fourth big one, altering, backdating, or hiding errors in medical records. This goes right to the heart of integrity. It's dishonest, potentially puts patients at risk, and again, it's a serious GMC matter. Honesty and transparency are key, even when admitting mistakes.
Okay, those seem pretty clear-cut. Treat friends, family, no. Public arguments, no. Delaying safety action, no. Falsifying records, absolutely not.
That's the core list. Remember the underlying principle. Anything that compromises immediate safety or fundamental integrity is likely to be a very low-scoring option.
Right. But what about the trickier ones? The trap answers. The options that sound, oh, well, they sound reasonable, maybe even polite, but they actually lose you marks.
Ah, yes, the pitfalls.
Yeah.
These are more subtle. They often prey on politeness, or perhaps common, but not technically correct, practices.
Give us an example.
Okay, a classic one might be where there's an issue with a colleague's performance. Maybe they seem stressed or are making minor errors. An option might be, suggest addressing this during the colleague's annual appraisal next month.
That sounds quite supportive and procedural, doesn't it?
It does sound supportive, and appraisals are important. But if the issue potentially impacts patient safety now, or involves a breach of policy now, delaying action until the appraisal isn't appropriate, urgent concerns need addressing urgently, even if it's uncomfortable. It fails on the timeliness aspect of safety.
Okay, so wait and see is often wrong if safety is involved. What about another trap?
How about this one? Tell the family everything about the patient's condition to reassure them.
Sounds caring, wanting to keep the family informed.
It does. But everything is the trap word. You have a strict duty of confidentiality to the patient. You can only share information with the patient's explicit consent, or if it's legally required, or in very specific circumstances like immediate risk where the patient lacks capacity. Oversharing, even with good intentions, is a breach of confidentiality.
Right. Confidentiality is paramount. Need consent. What about that off-duty scenario we touched on earlier?
Yes, the option like decline to help as you are now off duty. This comes up in various guises.
And it's a trap because...
Because doctors generally have an ethical and arguably professional duty to offer assistance in an emergency situation, provided it's safe for them to do so, and it's within their level of competence.
Even if they've finished their shift and are walking out the door?
Even then. Now, this doesn't mean you have to take over complex care single-handedly. But you can't just ignore someone collapsing in the hospital car park, for example. Your duty might be to assess, call for the on-call emergency team, start basic life support act within your abilities to ensure help is summoned and initial care is given.
So the duty of care doesn't entirely switch off the moment you clock out, especially in an emergency.
Not entirely, no. The golden rule with traps is, does the action delay a necessary safety step, breach a core principle like confidentiality or integrity, or inappropriately pass responsibility? If so, even if it sounds polite or easy, it's likely a trap.
That's really helpful. Okay, understanding principles, scoring, and traps is great, but let's get really concrete now, especially for those best three questions where you need that perfect combo. You mentioned a trio template.
Yes, the trio template. This is about building the ideal response package for those choose 3 of 8 questions. It's a mental checklist to ensure your 3 chosen actions cover all the essential bases.
So what are the 3 components of this trio?
Okay, step 1. There usually needs to be an immediate safety step, What practical thing needs doing right now? Checking the patient, stopping an unsafe action, reviewing vital information.
The immediate doing part.
Exactly. Step 2. There needs to be a senior or policy step. This is about accountability and governance. Does a senior need informing? Does a local policy need following? Does an incident form need completing? It's about involving the system appropriately.
Right, the escalation or procedural part.
Yes. And step 3, there's usually a communication or documentation step. This could be speaking to the patient or colleague involved, privately, respectfully, or ensuring the situation and actions taken are clearly and objectively documented in the notes.
Okay, so act safely now involves senior policy, communicate, document.
That's the essence of it. When you look at the 8 options, try to find one action that fits each of those roles. The best answers often package these things together neatly.
Are there sort of model phrases that tend to signal these good options?
Yes, often there are. Phrases that combine these elements are usually strong contenders. Things like, escalate your concerns to your supervising consultant immediately and ensure you follow local incident reporting policy. See, that hits safety, escalation, and policy.
Okay.
Or arrange to speak with the colleague privately and respectfully as soon as possible to understand their perspective, agree a way forward, and then document this conversation objectively.
Yeah.
That covers communication, professionalism, planning, and documentation.
Right. Another example.
Give you something direct like, my immediate priority is the patient's safety. I will take steps to ensure that, report this via the hospital's incident reporting system, and discuss it with my educational supervisor. Again, safety, reporting, escalation.
So look for options that combine immediate action with involving the system and ensuring things are recorded.
That's a very good summary of the approach.
Okay, let's apply this trio template rigorously to that handover scenario we discussed earlier. The junior doctor coming onto the ward finds a colleague planning to discharge a patient admitted after a suspected TIA, but the CT scan report isn't back yet and the notes seem incomplete.
Right, a classic handover dilemma with potential risk.
We agreed the best 3 options were B, D, and H. Let's break that down using the trio. Option B was, ask the colleague privately to review the notes and pending CT results before the patient is discharged. Which part of the trio is that?
That feels like the initial communication step, combined with an immediate safety check. It's professional, privately, respectful, and directly addresses the potential risk. Review note ECT. It gives the colleague a chance to correct course. It hits the E in safe E first.
Okay. Then option D was, if the colleague refuses to review the information or dismisses your concerns, raise this immediately as a patient safety issue to the senior doctor on call.
That is clearly the senior policy step, the escalation. It's the safety net. If the initial communication fails, your duty to the patient means you must escalate. This hits S for safety and A for authority hard. It's non-negotiable if the first step doesn't resolve the risk.
Right. And finally, option H, objectively document your concerns and the conversation with your colleague, including the outcome in the patient's medical record.
And that's the crucial documentation step. It ensures transparency, continuity of care, so the next person knows what happened, and provides an objective record of the actions taken to mitigate risk. It fulfills the governance aspect.
So B, communicate check. D, escalate if needed. H, document. It fits the trio. Safety action, senior policy action, communication documentation action.
Perfectly. And notice how other options fail. For example, having a public argument with a colleague, option E in some versions, fails on professionalism in say C. Or just taking over the patient's care without discussing it might seem proactive, but it misses the chance to address the colleague's practice, which is also a system issue. Or telling the family, we're not sure if it's safe to go home yet, without context, could cause unnecessary anxiety and potentially breach confidentiality if specific results are discussed prematurely.
So choosing B, D, and H together provides that comprehensive, safe, professional response.
Exactly. It addresses the immediate risk, uses the correct channels, and ensures accountability.
That really clarifies the thinking process for those best 3 questions. Okay, as we wrap up, let's try and synthesize the absolute core message from all this. If someone remembers only one thing, what should it be?
I think it boils down to this. Aim to be boringly safe and professional every single time.
Boringly safe.
Yes. The exam isn't rewarding maverick brilliance or risky shortcuts. It's rewarding consistent, predictable, safe, policy-compliant professional behavior. Anchor every decision back to those core principles we discussed, rooted in good medical practice.
Patient safety first, work within competence, communicate properly, teamwork with candor, maintain integrity.
And apply that trio. What's the safety step? What's the senior policy step? What's the communicated document step? If you consistently apply that framework, you're demonstrating exactly the kind of reliable, good judgment they're looking for.
That makes perfect sense. So for our final provocative thought for the listener, we kept coming back to documentation. You stressed it with the trio. It's in the red flags. Why is putting pen to paper or fingers to keyboard so incredibly important in this context? It feels almost administrative sometimes.
It might feel administrative, but its significance goes way beyond that. Think of it this way. Good documentation isn't just about recording what happened for the next shift. It's actually a core part of your professional accountability and defense.
Defense.
Yes. Under GMC scrutiny, or even in legal situations, your notes are often the primary evidence of your decision-making process. Good notes don't just say what you decided. They should ideally show why you decided it.
Ah, the justification.
Exactly. If you face a difficult dilemma, you escalate it. Maybe you follow a policy, documenting that conversation, that decision, the rationale. That becomes proof that you were thinking critically, acting professionally, prioritizing safety. It demonstrates your integrity.
So the act of documenting isn't just closing the loop, it's actively demonstrating your professional judgment.
Precisely. Your judgment in the eyes of regulators or investigators is often only as strong and defensible as your record of it. So as you practice these scenarios, really think, how would I document this to show I acted safely and professionally? That mindset shift is incredibly powerful.
That's a fantastic point to end on. Your notes are your evidence of good practice.
We really hope this deep dive has helped demystify some of the thinking behind professional dilemmas and given you a clear roadmap for tackling these questions with confidence.
Absolutely. Thanks for joining us on the deep dive. We'll see you next time.